Hi, I'm Leah Binder. I'm CEO of the Leapfrog Group. I'm talking today with Rob Andrews. He is going to keynote our annual meeting, which is December 6th. The topic is Right Now, the Urgency of Patient Safety. And it certainly is urgent. So, Rob is CEO of, as I said, the Health Transformation Alliance, which I think is one of the most exciting organizations in Washington, period. And I think it's doing some of the most exciting work. And it is just a delight for Leapfrog to have you come to our annual meeting, to keynote it. And also, we're members, so to be part of the Health Transformation Alliance. So I really am so pleased to have you join us. So tell me, Rob, what do you plan to say?
Leah, you and I have been at this together for a lot of years, and your friendship and partnership means a lot to HTA and to me personally. And in the years that we've worked on this, I can't ever remember a time when more employers were more stressed about recruiting and retaining employees.
Yep.
The number one thing I hear from HR leaders throughout the country is finding and keeping the talent they need is an urgent priority. And health benefits are such an important and compelling part of that urgent priority. And health safety is, in my view, an essential part of walking the walk when an employer says to an employee, we really care about you and your family. Now, I think that's true almost all the time, but it's more important to prove it than to say it for an employer. What hospital safety and provider safety is ultimately about is that when a person in your health plan has a family crisis, a problem pregnancy, or a chronic disease, or a cancer diagnosis, it becomes the most important thing in their life. It becomes the most important thing in their family's life. And an employer who would step forward and say, we understand that. And that's why we've put our time and energy and effort into trying to find the providers or the best places for you to go. The place where you're most likely to have a great outcome from that pregnancy and least likely to have a crisis. The place where to get a fighting chance to get remission from that cancer, we want to find it for you and steer you there. I think that's an important thing to say to employees. I think it's a necessary thing to say to employees. And without the work of Leapfrog, it just doesn't happen.
I think that's such an important point. I think the issue of the workforce, as you said, is critical for employers because they want to offer extremely competitive health benefits right now. And there's nothing competitive about sending an employee to a place where they accidentally get the wrong medication that, disables them or something. That those kinds of things happen, unfortunately, quite a lot, but more often in some places than others. And those are not places that you want to be sending employees. So people really do need to know about this. But I would add one thing, which is that that's true for the healthcare system as well. The workforce crisis for the healthcare system is very substantial, and addressing patient safety can have an impact on reducing some of those shortages because people who care about healthcare want to work in a safe place as well. So there's
some of our
to it.
best members, Leah, are healthcare providers,
Yep.
a small number by design. But yeah, they're employers too. They wear two hats.
Right.
And if you're trying to recruit a nurse or a therapist or a physician or a environmental services worker in a hospital setting, and you say to them, it really matters a lot to you that you and your family get good health care, but you don't practice it. It's a place where the records would show that incorrect medications are a frequent problem, or cleanliness issues persist. It all really comes down to this question. If it were my mom in that bed or my spouse in that bed, am I comfortable that she is going to get the very best care there is to be delivered? And Leapfrog gives us a way of answering that question. It's not a perfect way, it's not a flawless way, but it's a powerful way. And I would think that an employer, whether they're a healthcare system, a hotel chain, a soda pop company, a bank, would want to say to the men and women who work for them, we take that seriously because we take your health seriously. So I think the nexus between the work that Leapfrog does in identifying safe and high value providers and the aspiration of employers to be known as a truly great place to work is an important nexus. And we want to explore that together in December.
Absolutely. I think one of the exciting things about HTA and what you've brought together is some of the really the world's most aggressive employers who care so deeply about their employees that they will do what has to be done to make sure they stand up for them and make sure they're getting the care that they need and the care they deserve. So that is what makes it so exciting to work with you, is that we can together, I think, really make a difference in healthcare, make a difference for employees, and make a difference for the healthcare system itself. Really make it a great system that we all want and deserve.
Thank you for saying that about our members, that whether someone's making a deposit in a bank at JP Morgan or using their Amex card today or having a can of Coca-Cola or staying in a Marriott or driving down a road where there's a Caterpillar tractor that's helping to repair the road, the HTA is in all those places. And the men and women who are doing that work for JP Morgan or Caterpillar or Amex or Coca-Cola or Marriott are the people that we help to take care of. And again, at the end of the day, I really think this comes down, it's a question I sometimes ask physicians. My wife and I have raised two daughters that are now young women, they're in their 20s. But the question we always asked when they were little, and still ask, is if this were your daughter, what would you do?
Yeah.
I think it's the best way to have a conversation with a provider. And Leapfrog sort of asks that question for all of us. That we'd want our loved one, our family member, to be in a place that excels at producing great outcomes for patients and keeping them safe. Not that makes an effort at it, but it's really great at it. Being evaluated makes people nervous. All of us are a little nervous when we're evaluated, but we get better when we're evaluated. We aim higher. We are more careful in our work. And I just can't think of an area where aiming higher and being more careful is more important than healthcare. When a baby's being delivered, or cancer is being treated, or a person has COVID or whatever it happens to be. So I think the work of Leapfrog, which we're proud to support and advocate for, is essential to achieving the objectives that our employers have.
Well said. Thank you. And we are full speed ahead, and we appreciate you and your members standing up for what's right and standing up for the health of their employees, because that's really what it's going to take. And that's why it's urgent. And that's why our meeting is about urgency.
The urgency too that we saw earlier this year when the Medicare proposed regs came out that would have suppressed some incredibly important information about provider safety. That looked like a done deal until Leapfrog came along. And the coalition that you rallied and the arguments that you marshaled made an incredible difference. And happily, those changes were withdrawn, and that information is going to remain in the public domain where it should. So that's the side of the rope we want to be pulling on in this tug of war. And the urgency of getting that done was something that wouldn't have happened without Leapfrog's leadership.
And your leadership too. I appreciate that you were a very strong advocate for transparency, for making sure that we get what we in the public need and deserve in terms of information about how healthcare providers are doing. We just simply need to know.
We're living in an economy where transparency is a norm, it's an expectation, except for healthcare. In healthcare, transparency has to be won, not just absorbed. And that is going to change. The public is going to demand it. Consumers are going to demand it. But I think we should accelerate it. And I think the topic of our time together in December would be the most effective means to effectuate that acceleration. and then the benefits of having that acceleration occur.
Great. Well, that's a good goal for us. Accelerate transparency, accelerate change. So thank you, Rob Andrews. We're excited to have you as our keynote at the Leapfrog annual meeting, December 6th in Washington in person. Thank you. Thank you for joining me today.
My pleasure.